Hello and welcome to the latest Science of Sport podcast. I'm your host Matt Solomon, and today I'm delighted to be joined by Matthew Ibrahim. So Matthew is a strength and conditioning coach, and he has been since 2007. Recently, he's moved into academia, where he works at Endicott College as a clinical coordinator and a course instructor of exercise science. Next to that, he's also a strength and conditioning coach for the basketball team, and that makes him the perfect person today to discuss how physios and strength and conditioning coaches can learn from each other in order to get the best out of their performance. So without further ado, it's time to welcome Matthew onto the show. So Matthew Ibrahim, welcome to the Science of Sport podcast. It's a pleasure to have you back again.
Matt, thanks for having me back, man. I really appreciate it. Looking forward to jumping in.
Thank you very much for taking the time to come back a second time, because obviously we had some technical difficulties with the first one, and you've very generously given up some more time. So, mate, thank you very much.
Absolutely, yeah. I mean, we got the reps in, so it's got to be perfect, right?
If it's not good now, mate, I don't know how to make it any better. We've already tried. So
there we go.
Before we get into it, can you give us a quick introduction to who you are and what you've been up to until now?
Yeah, the simple way that I always take this part on is just I'm a coach in everything that I do. So if I'm in my full-time role as a clinical coordinator of internship here at Endicott College in Boston, Mass, taking care of internships, mentoring students, getting them in the right spots. I'm also a professor of exercise science as well, so academically in the classrooms. If I'm coaching the athletes in the weight room, if I'm traveling, speaking, if I'm all this type of thing, I'm coaching, I'm instructing, I'm educating, I'm guiding, I'm facilitating learning. So for me, that's super important. I'm about a year left, my Ph.D. Apologies, less than. So about May 2024. I'm also in a master's degree here, simultaneously here at the college.
Wait a minute! I've just had 3 different jobs: a PhD and a master's. How's that going?
With the so I already have a master's. This is more of sport leadership, a little bit different track. Fortunate enough to do it in the same school of sports science here at the college. So very grateful for that. And then a book through Human Kinetics. It's already been sent to the editors for training for athletic performance. I'm waiting till about mid-November to put some final touches on that, and then we'll blast that out, hopefully early 2024. And then probably my passion project, Athletic Performance University, or APU. I run that like a course, undergraduate course. So that's for if you're an undergraduate exercise science student, or if you're 1 to 5 years in the field as a strength and conditioning coach or personal trainer. It's all S&C foundations for that specific population. I have physical therapists in there as well, which will lend credence to the topic we're going to discuss. But I run that as an 8-week semester in the spring, the summer, the fall, year round. So we're wrapping up another month of the fall, and then we'll head into the spring soon.
Wait, can you just quickly take me through how you do all of that? How many hours have you got in a day? Have you got like little extra little secret hours somewhere?
I have a very patient and caring and thoughtful and loving wife who, the agreement is just put your head down and work and do what you can. And so I'm very fortunate and grateful, and I don't take any of these things for granted, that I have opportunities to help. And so for me, that's the most important thing. I have a grandmother and parents and grandmothers and grandfathers and parents who migrated from Italy, migrated from Armenia. And so the service-based mindset is instilled in me, and how can I help? That mentality. So I'm just grateful, man. Grateful.
Absolutely excellent. So obviously we need to discuss how physios and S&C coaches can kind of learn from each other. So before we get into exactly those things, can you talk us through what those roles are? So they're separate roles, although there's huge links between the two of them. So just to define exactly what a physio does, or an athletic trainer, however you want to describe that in the context of your country, and a strength and conditioning coach.
Yeah, no, for sure. And I want to be, like you said, man, I want to be respectful of the context of the country. I'm going to use the word strength and conditioning coach and then physical therapist, but like you had alluded to, S&C coach, personal trainer, fitness professional versus a physical therapist, a physiotherapist, sports medicine provider, athletic trainer. So I'm going to look at it like that. So the S&C coach's job, essentially, you're programming and coaching for the goal of building qualities in strength, power, cardiovascular endurance, hypertrophy, so on and so forth. With physical therapy, the goal is more, there's evaluation, there's diagnosis, there's targeted rehabilitative approaches for a specific injury, and then there's a very progressive model from a rehab standpoint to then add graded exposure of exercise to get someone back to returning to their activity, their fitness level, their sport, their athletics, or so on and so forth.
Absolutely excellent. So with those two differences, what do you think are the key skills which then a physio or the medical practitioners will use?
So from the physio side, I think the most important thing is that we understand physical therapists, physios have a great knowledge of how to diagnose, how to evaluate, how to examine, how to rehabilitate and regenerate tissue, joint, tendon, help someone do those pieces. What I think is really important for physios to add to their tool belt is program design and periodization. Not just, and I'm saying this from the lens of I want this to occur in doctor of physical therapy school. I think it's needed, where most physical therapy schools give out therapeutic exercise classes, right? Whereas, what about program design? What about periodization? What about understanding load and how building tissue capacity outside of tissue remodeling and rehabilitative formats? And I think that's a missing link that physical therapists can learn from the strength and conditioning world. You'll see this right now. A lot of DPT programs, so doctor of PT programs in the States, are adding into their curriculum strength and conditioning principles for physical therapists. It's being added in at a high level, so much so at the APTA level, American Physical Therapy Association level, that there is a specific push for that, which I think is very important, because if you come out of PT school and you don't know how to add load or resistance train or strength train or program outside of your typical, and I'm putting up air quotes, 3x10, you're not going to provide any sort of physiological adaptation for someone that they're going to need when they sprint, cut, jump, land, play athletic sports. Sure, maybe 55-year-old Joe, who's a mailman, will be fine. But what about Matt, who plays professional soccer? He needs to operate at high intensities. We know that the weight room, the fitness center, you cannot replicate in-game, in activity, in sport intensities and speeds. It's literally impossible. However, you can put a really good dent into it if you apply some of those skills in the weight room or in the clinical setting.
Absolutely excellent. So when it comes to what strength and conditioning coaches can learn from the physios, then how is that different? Because I say physios endlessly, by the way. I'm trying to switch my mentality there. Mm-hmm. So from the medical side, what can the strength and conditioning coaches then start to learn?
It's a great question. So what I like to add in my exercise program design course that I teach at the undergraduate level, I've taught it for 5 years now, 3 different programs, and it's also part of what I do in my mentorship, is teaching strength conditioning coaches the value of not just using RPE scales and RIR, like reps and reserve scales, understanding and building out a visual analog scale, or using literature to operate with that lens. In simple terms, a pain scale. So the literature talks about a 0 to 10 visual analog scale, or VAS. And the literature talks about between a 0 and a 5 is acceptable from a pain scale, whereas above a 5 to a 10 is unacceptable. We don't want someone doing that, meaning you sort of have to kind of muddy the waters a bit. So if Matt comes in and says, all right, I'm dealing with Achilles tendinopathy, you knew I was going to talk about calves, and we're doing some heel raises, some single leg heel raises, eccentrics, tempo work, and Matt says, I'm like, hey, here's a pain scale. 10 is the most highest level of pain you've ever experienced in your entire life. 0 is no pain, you're sleeping, right? And Matt says, all right, I did a set. Hey, coach, it's about a 4 out of 10. Great, keep going. I'm okay with that. The visual analog scale talked about a 0 to 5 being okay. For me, I like to utilize a 0 to 4. If I have someone who tells me they're a 4 out of 10 after I've given you the context and I've showed you the scale or the chart, and you say to me, hey, it's a 4, I'm gonna yellow flag that and say, okay, let's continue to monitor this. Let me collaborate with a sports medicine rehab professional. Let's just be alert, but we're not gonna make any changes yet. If Matt next time he does it says, hey, that's a 5 out of 10 pain, I'm gonna completely stop. I'm gonna regress or lateralize the exercise, just decrease intensity or volume, whatever one I feel best, and get to a place where I want it to be a 4 or lower. I'm going to also collaborate with a sports medicine professional. I'm also going to advise that athlete or client, I think you should go see that sports medicine professional, get their clinical insight, and then come back to me. Now we have that triangle, right? We have that high performance model team triangle where I'm the coach working with the rehab provider, helping the athlete stack wins.
Absolutely excellent. So before we get on to like how you can go about doing those things and how to learn those skills, because you've obviously just talked through a little bit how to do the S&C side, but I'm excited to hear about how you can really apply that and get that knowledge and really take that further. But before we do that, I'm interested to hear what you think skills are which both of those groups could be learning to bring their performance to a higher level.
Number one, communication. Like, this is the most underappreciated, underutilized tool in our field that people just kind of like, nah, I don't need that. It's not important. Open line of communication. I literally spent a year and a half as a nomad, personal in-home strength coach, traveling to people's homes in the area where I live. I got all 15 of those athlete or client opportunities via 3 different PT clinics. Simply because I knew them, they knew me, and we kept an open line of communication. And I felt very comfortable saying, hey, Dr. So-and-so, I got this client dealing with X, Y, or Z injury. I would love for him to go to you to get an evaluation. And then that PT said, wow, like, you're not afraid of losing money? Like, people are afraid of losing money. Why? It's helping the athlete, it's helping the client. So I would send clients to PTs all the time. There was 3 particular PTs locally that I would send them to, or physios, and I operated as the coach. And we kept those athletes and clients healthy, and we both made money, and the clients won, and they got healthier. They built strength, they built health, fitness, whatever, like all their goals. So to me, I think communication is number one. Having an open line of communication. Number 2, being comfortable with being vulnerable. I think there's this thought process where a strength conditioning coach might be like, well, I have all the answers. I don't like saying I don't know, and what I say goes. That may very well be a thought process in the physical therapy world as well. Hey, I'm a medical provider. I know what's best for this athlete. Why not have a conversation? Why not be okay with being vulnerable? Dr. Merrick Lincoln out in Michigan writes a lot for T Nation as well. He just did a guest lecture for my APU mentorship last night on this exact topic: how to build a homegrown high performance team model with physios, with strength coaches, with and how to operate. And so he echoed this as well. So number 1, open line of communication. Number 2, being comfortable being vulnerable and not having all the answers, because you need to work together as a team. So you see Michael Jordan above me in the video. Michael Jordan, he wasn't grabbing all the rebounds and blocking all the shots. He was the scorer. He was the killer. Dennis Rodman grabbed the rebounds, blocked the shots. You have to play your role in the team.
Absolutely excellent. So obviously, when we're looking to learn all of these different things, you can't just do it with a book. Like brilliant if you can, but most people can't do it with just a book. So how can these practitioners go about learning the skills which you've mentioned in order to then improve their performance in their work environment?
Time and observation. So number 1, spend the time to learn about the other individual. I'll use my standpoint. So I'm a coach. If I want to learn about the physical therapy side within my lens, right? So within my coaching lens, I'm not going to do joint manipulation. I'm not going to do, diagnosing injury. That's not my lens. However, I can learn how a physical therapist operates by spending the time to listen to them, to talk to them, to meet them in person, just talking through it, and then also observing them in action. Hey, Matt, I heard you're a great physio in the town over. Do you mind if I just swing by for an hour and just watch, take notes, and learn about you and ask some questions after? Yeah, why not? So spend the time to learn about them, talk to them, spend the time to observe them in action, doing their job, and then you can follow up with questions. And then what you're going to do is, in my opinion, I'm showing you that I value your skill set. Who doesn't like to feel as though they're valuable, right? So, hey, great job, Matt. I'm a huge fan. Like, that was great. Like, I could see how this could apply and how I could then take some of these elements and use them in my setting as a strength coach. When you show that level of sincerity, like, I genuinely appreciate what you do, I think what you're doing is you're building trust, you're building buy-in, and you're enhancing that team effect.
Brilliant. So obviously you've got all of those different things put together. You've gone, right, we can go through the skills you need, how to do them. Mm-hmm. I'm interested to hear if there's any top tips you would give young, aspiring strength coaches, physios to really like accelerate that process, right? So you obviously mentioned that those are the people you're working with, right? The students, you've got people going through your course as well. What advice would you give to those people to really make a difference and potentially stick out from the rest?
Yeah, man, I think there's billions of con ed courses, continuing education courses out there. If you're a physical therapist in the rehab world, go to a strength conditioning con ed course. Go learn from them. If you're a strength and conditioning coach, go to a rehab sports medicine physical therapy based course. Now I understand someone listening might say, well, you have to have a certain certification or certain credential. Yeah, for some of them, but not all of them. Like, for example, if you're a physical therapist, go to a National Strength and Conditioning Association clinic or conference. That's one example. If you're a strength coach, I'm sure that there are plenty of rehabilitation or physical therapy type models out there. A good one that I know, they travel a lot. They do a great job. Michael Mash, Barbell Rehab. His team of physical therapists teach physical therapists how to do SNC. It's phenomenal. So these are just a couple examples, but learn from the other side. I know this sounds so obvious and like come on, duh, but you'd be shocked at how often people are afraid to get out of their comfort zone. That's the key.
Brilliant stuff. So, Matthew, Ibrahim, massive thanks for your time and effort today. I've really enjoyed it. Where can people find a little bit more about you and what you're up to?
So, number one, athletic performance, and then the letter U, athleticperformanceu.com. That's the mentorship. And then hit me up on social. Instagram is probably the easiest place. Matthew Ibrahim _.
Brilliant. Massive thanks, mate. It's been a pleasure talking and look forward to speaking again soon.
Thank you, brother. Appreciate your time.
Cheers, buddy. And that's it once again. A massive thanks to Matthew for all of his hard work on today's podcast. I really appreciate it. I'm sure you do at home too. Before you leave, I want to point you in the direction of the Science of Sport Coach Academy. The Coach Academy is an overgrowing library of sports science courses which are broken down to bite-sized chunks. So after Matthew's talk today, I'm sure you're excited to get into them, and you can do that completely for free for the next 7 days using the link in the show notes. And what's more, every time you complete a course, you get a certificate of completion to prove your ongoing education. And Matthew has actually provided one of the courses in there as well, looking at the ankle and the calf. So get yourself in there for free for 7 days, hitting that link in just a few seconds' time. And of course, if you've enjoyed today's podcast, it would be fantastic if you could recommend us to a coach, a colleague, an athlete, or a friend. That means that we can keep bringing the best possible guests and the best possible content. And that's it. Once again, a massive thanks from me. I'm Matt Solomon of Science of Sport, and I'll speak to you next week.